We've all heard terms of good student, bad student, difficult patient, very nice patient, or a difficult customer, or a very rigid customer, inflexible. Oh, that is a stubborn client, or we generally tend to categorize people into difficult and something which is very nice, how good, wonderful. So there are these good, bad categories we generally classify everybody into, including parents. Like, for example, if you look at different relationship dynamics, starting with children, there can be a parent say, okay, my first one was very easy, second one is not like that, very difficult. Or a teacher might say, okay, this class was very easy, but this class is very difficult. Or this child is very difficult and stubborn, and but this set of children very nice. Or even with patients, medical doctors. So that's a very difficult patient. It's very difficult to work with that. Or I also got caught up in this narrative of good client and not so good client. And what is this whole narrative about good and bad that we classify, or difficult, stubborn, rigid, is basically, it boils down to whoever listens to us, whoever obeys and does exactly what we say, they're good. But anybody who's not listening to us, who's doing something diametrically opposite of what we are telling them, or they argue and talk back, or they ask too many questions, or they are distracted and just not listening to us, they're in their tangent telling something else, and we are trying to bring them focus back to what we are saying. And there is a kind of a power dynamics where we are not feeling like we are in control of the narrative. And this specifically when it comes to equations, when we are in a position of a higher power structure wherein the other person is coming seeking help to us, and we are positioned as the helper, where there is an unwritten power structure of we are the helper and the other one is seeking help, wherein the need of the other is for help is considered larger than this need of the person to help the other person. So there is a unwritten power dynamics there in such relationship, which is parent, child, teacher, student, patient, doctor, patient, therapist and client. Everywhere there is or a boss and an employee, there is a power structure, isn't it? So um, somewhere we need to understand that this whole narrative comes with who obeys to us. It's boiling down to obedience, right? In all of these. So I used to get into this narrative of who are the good clients. I feel, oh, somebody who comes, we have a nice discussion. They really get everything that I'm saying and they're very thankful and they say, oh, now I really understand, I could gain this knowledge, and they really get it, and they go back and apply those knowledge, and they come back and say, oh, I applied it worked. Or even if it didn't work, they come back and say, oh, this didn't work, now tell me something. There is a great exchange and motivation and willing to work and wanting to learn, coming back to us and asking questions in a very motivated manner, we say as good, isn't it? But then I realized, if there is a client who is consistently coming and showing up, in the sense, especially in my case, they are paying and then coming and then not doing anything what I'm asking them to do, but they're consistently coming. And this used to make me wonder what is happening. Where is the difficulty? So we rephrase these labels of difficult client or resistant to change, or they come and say that no, this I have tried, this is not going to work. Oh, this no, my life is going to be like this, nothing can be done. And they're resistant to every different things that we are trying, and but they keep coming. So this was something which I got very curious about. How come they're coming consistently every week? And then they say the same thing. And we say, okay, what about this? No. Some of them might be just cribbing and whining about their life situation. It could be about their partners, husband or wife, or it could be about their parents. It could be about their jobs and how horrible their job situation is, or it could be about a traumatic event which they want to re-narrate. And I generally listen for one session, two session, three session, four sessions. Yes, acceptance, validation, all that is given. And then when I feel, okay, why is this not moving forward beyond validation, and where am I getting stuck? So technically, the difficulty was with me. I couldn't figure out, I was finding it difficult to support or help the other person because somewhere the other person was also staying stuck means I'm also staying stuck, isn't it? So when it comes to a teacher student also, it's the same thing. This child is not listening to me means that child is stuck in a pattern. I'm also stuck in a pattern. I do not know how to get this child to listen because I have tried a zillion different methods and I'm stuck. So something, I'm also going through a difficulty as much as the child is also going through the difficulty. So when we face such situations, what is the best thing is to slow down and figure out, why am I getting irritated or angry, or where am I feeling stuck? What is happening to us? This questioning oneself needs to happen, especially when it is in a power dynamic situation. Doctor patient, therapist client, boss employee, parent child, teacher student. The person who is considered in a higher position will have to reflect and see, how come this person is feeling stuck with me? What is happening in this relationship that we are getting stuck? What am I missing or what am I not seeing? Maybe it's that expectations are mismatched. Maybe they came to the session expecting something else. Maybe that is not what I deliver. Then maybe that communication didn't happen, that, oh, this is not what I do. So maybe somebody comes to me saying that they need a diagnosis and I'm not a person who diagnoses. So then that clarity needs to happen in the get-go, and I will need to figure out, okay, maybe they were coming for this and maybe that is why this is going on and they're getting stuck. Or maybe the goal that we together created, even though it is together, they were saying, yes, I will do it because they really genuinely want to do it, but maybe it was too large. Maybe I'll need to break it down further, or I will need to ask them, how come? What is happening? How can I help you better? This is what I am going through in this sessions with you multiple times. How can we break these patterns? This patterns is setting up between us also. So in some, with some of my clients where I thought was difficult, who would come back or who would not come back up for a long time, they would disappear and then come back as though nothing happened, and we restart all over again. And when this went on, at one point when I noticed that I was getting triggered, it was becoming my trauma response where I started feeling, what am I doing? I'm taking their money. They are not progressing. What the hell am I doing? So I started feeling guilty. I started thinking that I am wasting my time. I started feeling that I should refer them to somebody else and I'm not making any difference. So it became a little blame shame narrative which I was giving myself, as though my self-worth was based on how quickly my clients will progress, or how quickly my students will learn, or how wonderfully behaved my child would be. If that is what is defining my self-worth, then that is an indicator that my healing is still a longer way to go, and that is some little bit of work pending in me. And I should be most grateful to these so-called difficult clients I've had, and have had these wonderful discussions with some of them who left because I said, can I refer? And because I started saying that, hey, this is somewhere we are spiraling. And some of them I referred and they moved on, which is fine. And I wanted to see that, okay, I'm not making it all about me, that, oh my God, I couldn't work, but they went to another therapist and they're working super fine. That's okay. Not all of us can work with all set of clients. We all have different skill sets. Sometimes starting and listening to a fresh perspective, just a fresh face or a fresh voice itself can make the difference. And maybe hearing the same things in a different, slightly different narrative can make the whole difference, isn't it? And that was not about me being a bad therapist or that client being a bad client or anything. We're all good. We're all actually striving to be good doctors, good patients, but somewhere along the line there can be mismatches. Either we miss, like I said, the expectations, or maybe they are coming with a lot of systemic barriers which I am missing. And there is a lot more to unpack than straight away jumping into solution finding. Or maybe the goals that I set was too big for them and I need to figure out, I need to break it down, and they're not really asking because they are taking so much blame and shame, saying that how can I ask them take it? Already this is looking so tiny, and how can I ask Seema to break it down again? Maybe. So maybe I should be the one asking. Or it could be that there are cultural differences which I am missing, especially when I work with clients who are not from my own state or my religious background or my gender or any other value systems that I might hold as a parent or in my marriage. So then maybe is that coming in the way? So this is where I need to decide how much more am I willing to learn from this person, because this person is showing up, they're coming again and again. So that was something which is very, very beautiful, which I'm still learning. And a big thank you to all the clients who I would have otherwise labeled as difficult, but showed me what difficulty I was going through and able to work on myself. Some, of course, I have missed, and that was also good because it was necessary that they moved to other professionals, and I myself could refer of some found. There were others who would be so angry and come back and say, my God, I spent so much money and there is no change. And earlier I used to take it very personally and I said, how else can I help? What can I do? These are the things. Where is it going? So going back and revisiting. And the good thing is I had each of these sessions documented so we could revisit. So these are the some ways we could figure out what is happening when there is a resistance to change, despite the other person reaching out and asking for help to change and still not being able to change. I think it is most important for each of us, those who are sitting in positions of power as helpers or healers or doctors, to slow down without blaming, shaming, without labeling the person who needs that help as difficult or unmotivated or stubborn or rigid or bad, or because that doesn't help us, that doesn't help the other person either. So maybe we also maybe need support because we also do not know how to work with some clients or some students or some patients. So that is a learning which is ongoing, because each client is a mirror. They are teaching a lot about ourselves on what is there unresolved. So I have to sit with, where was I feeling guilty? Why was I feeling guilty that I am taking this money? So if I didn't take money, would this guilt be gone? Would I feel okay with listening to this? But no, because earlier I used to be working for free for years, but that time I realized I was more angry. But now when I'm charging, probably I'm less angry. So then I used to feel people who would come, I would give a program, especially when I was working with children, and the mothers would come and say, no, no. They would come and say something completely different, not even what I asked them to do. And I would like, are the effort that I am putting into the program, why am they not putting it? Is it my child or their child? And I used to get into such thought process, okay, forget it, get lost. If you don't want to work, never mind. And I used to wonder, why am I going to this? What am I missing? So there has been times when once long ago there was this mother who I said, enough, I'm not taking your sessions because this is really not really being able to help. So this was long before when I was not charging. So I stopped taking the calls and I used to send a text saying I'm busy, or I started dodging. And then after a long time, she sent a long apology message saying that I'm really sorry. I know I'm such a bad mother and I'm bothering you also. But each time I could come and went, I felt so good. So that is when I realized, oh my God, it is actually making a difference. So many times, each time One of my very young clients told me just today that she was coming and repeating the same thing, which very specifically we decide she's not going to do. She goes, does the same thing, but comes back. And she comes back saying, Seema, I did it again. I said, okay. Uh, and each time she'll come taking a short 15-minute session to say that I just want to learn to practice saying that, accept that, yes, this is happening to me. And she said, each time I come back and tell you, and each time you are not scolding me, and each time you're saying, okay, so what can we do again? And I'm not saying it's okay either. I'm just saying, okay, so now what do we do? How can we work on this? What do you want to do? What happened? How come it happened again? And she would just narrate the entire context of why she did what she did yet again. But she said each time the intensity of the pain, and that was the frequency with which she was going back to the same unhealthy coping mechanism was reducing. The intensity of the pain to restart was reducing, and she felt it was helping. And that's when I realized all that I had to do was give that space for her to restart, come back, fail again, but come back and check that she is not a failure. Yes, she is failing at a particular task again and again. But that space that we can give people without blame and shame to come back and says, oops, it happened again, and say that it's okay, we can try again. I think that is the space I hope all of us had when we were children. And if we didn't, I hope we can at least give to all those who we need. It's not easy, very, very difficult, especially if you are not giving that same grace to yourself. It is very difficult to give it to other person also. And how do we learn to give this grace to ourselves if somebody else has given us that grace? So it's like a vicious cycle. So I hope we all can notice these patterns within us and in others. And when there is a power structure, it has to be the one who is sitting in a position of power to unlearn and break these patterns. So I hope we can all do that as professionals and see so much we can learn from the people who we are proposing to help. It is really a two-way process, and I can't be more grateful to all the wonderful people that I'm working with now. Thank you so much.